in our world,
Yep.
we have no patient feedback, because we don't have patients.
Right.
So we are really just outside of our system. And so a senior living facility, for instance, doesn't have patients.
Right.
They have what we call care recipients or
Right.
residents. But the feedback is excellent because the key, the desire is to stay independent. Anything that helps you stay independent, people drive towards. And there's an interesting aspect to this, that the elderly don't want to be a burden to their loved ones.
Right.
So if they can get a call that reminds them to take a pill, they'd rather do that, and then versus having their daughter call them to remind them to take a pill. They'd rather have a quality conversation. So it's an interesting aspect
Right.
that you and I maybe don't appreciate just yet. But over time, that allows them to have quality conversations and quality interactions with their loved ones.
What are like 2 or 3 things you expect over the next 5 years from this industry?
I think, if we're talking about mHealth and we're in the wireless life sciences, I think at the end of the day, the technology doesn't matter. I don't think we worry about how, the different components in a car are working. It's some higher levels of the car that we care about. Same thing, we shouldn't worry about how the technology works for an elderly person. It's about whether they enjoy using it and whether that becomes commonplace. So that's one area. Maybe 5 years is too early, maybe 10 years, but I totally agree with Rob. I think robots are going to be a big part of this. I think it's very simple to have some robots do some, basic care management, which sounds cold, but actually in the absence of someone else, it's very effective.
If someone out there has an idea, so is Independent open for collaboration with, new upcoming companies that might have an idea that they think should be part of your care continuum?
We're open in general. We're also, I have to say, very focused. So we have too much to do and too little people. But at the end of the day, we have some great partners that are on deck to come on board. I'll mention, for instance, Coro Health is a great one. They have a whole collection of 3,000 sermons and music therapy. So we can't be in that business. They already are the best of breed. So we want to integrate with them for the elderly. So in that vein, we're very interested in partners.
So besides monitoring adherence, the engagement portion isn't just my medical and health, it's entertainment too.
Huge part of it is entertainment. Certainly, as Rob was mentioning, all of us and the elderly today, there's nothing wrong with wanting to enjoy life, and that's what we want to do. Gamification of certain aspects would be great as a potential partner, and just games for the elderly, cognitive tools, and so forth.
Bingo.
Bingo,
virtual
exactly.
bingo. Basically.
And bingo.
Bingo and bingo, exactly.
Solitaire is a big one. Mahjong is another one.
That's right.
Scrabble.
It's funny because I thought I had a really good idea about your company, but when you think about it, you're more than just, hey, monitoring is important, but it's about them aging in place and what is going to be needed and what are they looking for, and they want interaction.
If it's about health,
Yep.
and not about CMS codes and sort of taxpayer subsidies on payments, the number one issue is social engagement. That's why we've missed the boat culturally here and many other places around how to address aging in place. It really starts with social engagement. But there's no code for social engagement. There's a code for chronic disease.
Yep. There's
a code for falling and breaking your hip. So you have to start from there, to your point, and that follows with a lot of other benefits. But if you don't start there, it's hard to sort of imagine somebody loving to take their blood pressure on time and loving to step on a scale and loving to press the pulse personal emergency response.
It's just about making it easy and making it part of their everyday. My last question for you, I ask everyone this question: what's your favorite app? It does not have to be a healthcare app that you think is really cool to use. It either makes you more productive or you have fun with it, or it could be a healthcare app.
Well, I'm not just saying this, but since I'm sitting here as I think, your app is awesome.
January when we're going to make some announcements around some of those customers, and I think certainly our goal is to be game-changing in how some of those partners that we talked about can have a better business using our tools.
I'm sort of a betting man. I'm betting on your company. I'm a huge fan, and keep up the good work. It's amazing.
Mutual. Good
No,
to see you.
it's great seeing
You're
you.
a Renaissance man.
Yeah, exactly.
I'll be behind the radio.
I'll talk to you later.
Good seeing you. Bye now.